Hey, so here's a bonus Tuesday edition of Dr. Rutherford and Hashimoto's. So we didn't want to gyp you out of in a presentation because we had a holiday yesterday, and so we're going to do a kind of a different subject on Hashimoto's. The question was. Tell me about Hashimoto's encephalopathy. And that's interesting because it's something in all the years I've been studying things, I've always kind of just blown off because encephalopathy means abnormality of the brain. Encephalo means brain, opathy means abnormality brain. I kind of equate it to peripheral neuropathies in a sense that peripheral neuropathies are abnormal dysfunctions of the peripheral nervous system, like the hands and the feet. But there's 100 different things that cause peripheral neuropathies. Hashimoto's encephalopathy has always struck me kind of like that, and I never really had my attention directed to it until this kept coming up as a question as to what is it. So I decided to kind of look into it a little bit further, especially since I actually am going to be studying this specifically in about a week in a class I'm going to. And I happen to have data on it. So I'm actually using notes on this particular subject because I wanted to be very clear on it because it's something I've always kind of thought, what's an encephalopathy? I mean, one of the teachers that I look to for good data in addressing brain function, encephalopathy is a brain abnormality, would say, don't overthink it. It's all inflammation. All the things that cause the brain to have a problem, it's all inflammation. You just got to dig and find out where the inflammation is. That kind of fits Hashimoto's encephalopathy. Let me just read to you what my notes say for the class, for the upcoming class that I've got here. Hashimoto's encephalopathy, also known as steroid responsive encephalopathy. Inflammation. you give the person a steroid and all of a sudden their symptoms improve. Associated with autoimmune thyroiditis, is a neurological condition characterized by encephalopathy, abnormal function of some different part of the brain, thyroid autoimmunity. So in this particular diagnosis, and they have 1 million diagnoses out there now for every single symptom that there is. For this particular diagnosis, you would have Hashimoto's, so you would test positive for the antibodies, and a good clinical response to steroid. So you would take corticosteroids for these brain symptoms, and you would feel better. And this is what they call Hashimoto's encephalopathy. I got to tell you, that's a lot of the Hashimoto's cases that come in here. The further reading, it says it's associated with Hashimoto's thyroiditis. It was first described in 1966. It is sometimes referred to as a neuroendocrine disorder, something between the brain and the hormones, the endocrine system hormones, blood sugar, thyroid, adrenals, all that. Although the condition's relationship to the endocrine system is widely disputed. It's recognized as a rare disease, which I did consider a rare disease, which is why I never really looked into it, and by the National Institute of Health's Genetic and Rare Diseases Information. Up to 2005, there were almost 200 published cases reported of the disease, but between 1990 and 2000, 43 cases were published, suggesting that this rare condition is likely to have been significantly underdiagnosed in the past. I have a personal feeling that hasn't been underdiagnosed. I just think that they don't really know what it is. They don't really know what causes it. So it's basically an encephalopathy with you having Hashimoto's. Symptoms, personality changes. Do I see that in most or many Hashimoto's cases? Yeah. People have mood changes, aggression, delusional behavior. If you have Hashimoto's thyroiditis and it's inflaming your brain, and it happens to have a propensity for your left temporal lobe, you're going to get delusional behavior. You're going to start hearing voices and thinking people are following you up. Concentration and memory problems. Who has Hashimoto's? that's full blown, that doesn't have concentration and memory problems. Disorientation, headaches. So these are all things I see pretty much every day with an average relatively full blown Hashimoto's cases. And frankly, by the time they get here, they're full blown because patients usually tried a bunch of other things. It hasn't worked. Been a bunch of places, it hasn't worked. By that time has destroyed a lot of tissue in the person's here. A lot of different other things. Seizures. I have a lot of patients who've had seizures that have gone away once the immune response against their thyroid has gone away. Sleep abnormalities, speech problems. So these are tremors. You know, Hashimoto's tends to also cause an attack against your cerebellum, and that can cause tremors, and that can cause balance problems and things of that nature. So it's really kind of, I don't know if it's like a real kind of a diagnosis. It's Alzheimer's, differential diagnosis. It can be confused with Alzheimer's, strokes, epilepsy, migraine, these types of things. People could lose their ability to speak. I have a patient right now who's got Hashimoto's. There are days she can't speak. She literally can't articulate because it's hitting a part of her brain called the Wernicke speech area and Broca's speech area. And so they can't speak. And then the inflammation goes away and they can speak. So for those who are interested in this, you know, it's really a gray area. It's really vague. It's almost to me like a forced diagnosis. I don't mean to sound like an expert, but I've seen a lot of this stuff, and experts are getting a really bad name right now. This is the time for those of you who are going to see this a year or two from now. This is the coronavirus time when none of us are getting headaches, and experts are telling us do one thing one day, do one thing the other day. This kind of has that feel to it. Okay, it's like they had to put a name on it. To me, it's Hashimoto's causes encephalopathy type of symptoms all the time. Hashimoto's has a propensity to decrease blood supply to your brain and increase inflammation. Well, what does the brain need to work right? It needs proper blood supply, so you have enough oxygen. It needs proper blood sugar. It needs proper essential fatty acid, and it needs a lack of inflammation. So 2 of those 4 things are included just in this diagnosis. So now you know as much about Hashimoto's encephalopathy, apparently, as the National Institute of Health's Genetic and Rare Diseases Information Center, because they don't know what it is either. So I mean, but it's good to know. Somebody's asking that for a reason. Maybe somebody told somebody, oh, you have it, and they're thinking, oh my God, it's a rare disease, I'm going to die, or something like that. It may be that I've had a ton of these cases come through because I have tons of people who've had these symptoms. And it may be that my mentor is correct. My mentor, the teacher that I like, who teaches the courses on brain function and inflammatory diseases and pathologies, and he says, don't overthink it. it's all inflammation, and to a large degree, we're inflammation hunters, and I think he's pretty right on that. So hopefully that helps whoever, or those of you who submitted those questions, that question on Hashimoto's encephalopathy.